Hello everyone. Today we will be studying about the process of dispensing from the chapter prescription, subject community pharmacy and management, presented by KG Saraf, KKW College of Pharmacy, Nasik. So what is the drug dispensing process? First step in the process is to receive and validate the prescription. Second step is understand and interpret the prescription. Third step, select and label medicine for issue. Then make a final check. Next step, record the action taken. Next, issue medicine to the patients with clear instructions and advice. So these were the steps, 6 steps of drug dispensing process. So one by one we'll see about the details of these steps. So the first step, that is to receive and validate the prescription. Pharmacists should ensure that prescription should have following information. Okay, when we receive the prescription, following information should be present so that the prescription is said to be valid. First is patient's information, that is name, age and ID of patient. RX symbol in the upper left corner. Name, strength, dose, form, frequency, route of administration and duration of treatment. Any additional instructions for the pharmacist regarding preparation and supply of medicine. Refill instructions in case of long-term therapy, and name and signature of the prescriber. So the first step means to receive and validate the prescription. As soon as we receive the prescription, we should check for all these things, whether the name, age of patient is given, gender of patient is given, whether the symbol RX is present or not. Then as far as the medications are concerned, name, age, name, strength, dose, frequency, route of administration, duration of treatment regarding the medicine should be there, should be given. If there is any additional instructions regarding the pharmacist or preparation and supply of medicine, it should be given. The name, and at last there should be the name and signature of the prescriber. Prescriber is the physician or the registered medical practitioner's name and signature should be there. So if all these things are present, then we say that the prescription is valid. Next step, understand and interpret the prescription. In that we have to see whether correctly interpret any abbreviations used by the prescriber. So abbreviations are the short forms which are given in the prescription. So if they are present, we first the pharmacist should be able to interpret it. Then confirm dose, frequency and duration of each medicine. Confirm that the doses prescribed are in the normal range for the patient. Correctly perform any calculations of dose and quantity to be issued. Identify any common drug-drug interactions and contraindications. So all these things should be done while interpreting the prescription. We should check all the doses are present in the normal range, whether there is some overdose or underdose given. If it is, then we have to inform the prescriber. We have to check whether all the calculations of dose and quantity are done correctly. Check whether there is any drug-drug interaction, pharmacokinetic or pharmacodynamic interaction, or whether there are some contraindications in the given prescriptions. So all these things are to be checked in the second step, that is understand and interpret the prescription. Third step, selecting the medicine. Appropriate system should be established for selecting medicines to prevent any medication error. Double check should be done to ensure that correct medicine is selected. Check the expiry date of dispensed medicine to ensure that they remain unexpired for the duration of supply, of course. Choose the oldest stock, that is first in, first out. So while selecting, you have to follow all these steps. Tablets or capsules should not be removed from the strips or blisters while dispensing. Medicines which need to be packed should be packed into a clean, dry container or plastic envelope, which will not compromise the quality of the product after dispensing. So we have to in the step selecting the medicine, we have to check it again whether we have taken out the correct medicine, whether they are in a proper condition, whether they have a long expiry date, and to have a proper packaging or put it in a dry container or a plastic or paper envelope. Then next step is labeling of medicine. So already the label is there, manufacturing label is already there, but the pharmacist has to put the dispensing label. So the dispensing label is to be affixed by the pharmacist on the dispensed medicine. So it should contain patient's name, generic name, strength and dose form of the medicine, frequency and duration, quantity of medicine dispensed, how to take medicine, storage conditions. So all these things should be included in the dispensing label. Then counter checking. Next step is counter checking. It can be done as a self check, but it is valuable to have final check done by other staff members. So it is, if we have done, we have all taken all the medicines out, we have put the dispensing label. So tell some another staff members to just counter check whether all things are correct or not. The counter check should include reading and interpreting the prescription without looking at medicines dispensed, checking the appropriateness of doses prescribed, checking for drug interaction, checking the medicines dispensed, checking the label, and finally countersigning the prescription. So it should be preferably done by other staff member whether all things are correct or not. Checking everything to be dispensed or drug interaction or not are there or not. Everything should be checked. Next is record the action taken. Record should be maintained like date of dispensing, patient details like name, age and sex, medicine name, strength, amount issued, dispenser's name. So all these things should be recorded, or record should be kept about the patient's medication. Medication history should be maintained. So issue medicine to the patient with clear instructions and advice. So these are some instructions given which should be followed or which should be included in our counseling, like tell the name and indication of medicine, tell how many times we have to refill it, tell the route, frequency, how long, duration, allergy, okay, regarding the medicine, tell how it should be taken, how it will have a good effect, educate the techniques of self monitoring, discuss the side effects, discuss drug interaction if there are, or drug food interaction, drug disease interaction, okay, tell them all the precautions about the disease. Then tell them about the storage recommendation, demonstrate them with adequate information, and ask the patient to repeat the key information to check his understanding. So this is the last step where we will highlight all the key points. We will take all important points to the patient and we will again check whether the patient has understood or not. So this was the steps of dispensing process and their details. Thank you so much.